Good evening, everybody. Wynn Brown with our St. Patrick's Day COVID-19 evening update for Haywood Healthcare. So I'm happy to give you an update on what happened over the course of the day today. So today, as of today, we've tested a total of 26 patients for the coronavirus. We have 5 test results back, all of which are negative. And all the other tests are pending, but we expect those results to begin rolling in. It's taking 48 plus hours to get the results in, so stay tuned on that. We did receive 200 new additional test kits today, which is great. So our availability of test kits is slowly increasing. We deployed about half of those to our urgent care and walk-in centers because that's where we're trying to have outpatients go to get tested from their physician offices. We are, feeling the change in volume and patients rescheduling appointments and us also proactively rescheduling them. And so over the course of the week, our outpatient speech and audiology services will be wrapping up at the time being. Still have inpatient services, but this is just outpatient. And then our PT and OT are also working to triage their patients to see which patients need to be seen at our Pearson Street facility on an outpatient basis and which ones can be rescheduled as well. Haywood Medical Group has been working all today to prepare to launch its telemedicine services for its primary care and specialty practices using Zoom and then getting their electronic medical record Athena set up to do that. Scott Jansen's and his team have been working very hard on our supplies, as you see on the national and state news, and just know from working inside our different departments that we are very tight on some of our supplies. And so we did get purple top wipes today, which made a lot of people happy, which is very important. And Scott's continuing to work on sourcing us PDI wipes, Purell, and N95 masks, disposable gowns, and other cleaning agents. Cleaning agents are getting harder and harder to come by. So Scott and his team are very focused on that. So I appreciate what they're doing. Today is a big surgery day for us today as we wrap up our last day of elective surgery on our campus. So I'm assuming the ORs are going to be going late into the night. And then after today, we will have 24/7 anesthesia on site to help care for patients. And we'll have an endoscopy call team set up as well. So those services will be available. I do expect that we will probably be doing surgery almost every day that is emergent and urgent in nature, and so we will have surgery going on, but we're just going to have smaller OR teams at the hospital at that point for that point in time until we get back to doing elective surgery. And then when we do finally do that, you can imagine the backlog that we're going to have to deal with. I mentioned in earlier conversations about creating a labor pool as our volume declines and the need for as robust staffing as we usually have declines. Staff that don't have an assignment will be able to be put into the labor pool if they want, and then we can pull from that to redeploy folks to other parts of our organization. We've also had a number of people have asked if they can just take ETO at this point in time or take time off without pay and come back into the labor pool at a different time. That's perfectly welcome. And so that's going to start this week. It'll probably be a little bit clunky, but really it's next week when it really fully will get going. Just on an upbeat kind of piece of news, I was told today by Don Cassavant that the Athol School District in particular, and a lot of school districts are doing this, has its school buses running its route, delivering breakfast and lunch to students and to elders to make sure that they get fed. We have a very high free and reduced school lunch population in our region, and we have food deserts and we have challenges around nutrition. So it's just great to see that happening. And of course, we're working as well as that because we have our weekend food backpack program. So we're working with different folks around food security. From a medical specialty perspective, it's important to know that most of the specialists that practice on both campuses, hospital campuses, are going to be coming in really primarily practicing out of the Haywood campus and providing telephone and video consultation to Athol and to our other physicians. So just to let you know that is on its way. A reminder that tonight the south entrance of Haywood Hospital will close to general foot traffic, visitors, patients, and staff at 8 o'clock, and we will consolidate to a single entrance tomorrow morning. And so just think about that as your commute come to work tomorrow, where you're going to park and the timing of all of that. And please be pause as you come through the entryway for your screening. Folks are working hard to make sure that everybody's well who enters our organization as we deal with the pandemic. One of the other things people have asked about, well, what about all the kids that get telebehavioral health services through our highly regarded telebehavioral health services, and all those students that were getting telebehavioral health services while in school are getting those via telemedicine at home. So that's great to know. So today, as I mentioned at the beginning, is St. Patrick's Day. I'm sorry I'm not wearing anything green. Maybe I'll wear something green tomorrow. My kids will pick it out for me. But in honor of St. Patrick's Day, you always have to have a blessing or a quote. But I came across a quote from Oprah Winfrey around luck, and I have slightly wordsmithed it for our situation today. Oprah says, "I believe luck is preparation meeting opportunity. If you hadn't been prepared when the pandemic came along, you wouldn't have been lucky." So we're lucky to have such a fantastic Haywood family that has been well prepared and well positioned. And I think we're really working hard to communicate what's going on around our family as well. So I wish you a happy St. Patrick's Day and appreciate all the great work you're doing as we continue our journey to be one of the best community-owned health systems in America. Thank you very much and have a great evening.